again, friends and loved ones. Welcome back to another episode of Thrive Alive, where we host health talks for the whole community. My name is Jamillia D, and I'll be your host to kick off season 3. Some of you may recognize me from the Ask a Doula mini-series that we did for Black Maternal Health Week last year. If you hadn't gotten the chance yet, check out some of those episodes in the description. We talked to other Black birth workers about the work that they do to impact Black maternal health. I'm very excited to be switching out my executive producer hat to be your host today, as we have a great show planned for you all. In this episode, we'll be breaking down the Chicago Department of Public Health's 2021 data brief on the state of health for Black people in Chicago. We'll discuss the major drivers of the increasing life expectancy gap between Black Chicagoans and other groups. We'll also discuss how the city's history of racial discrimination may contribute to the gap, and strategies we can take as individuals to increase our collective life expectancy. We want to acknowledge that it may be difficult to listen to some aspects of this episode. Nowadays especially, many of us may feel overwhelmed by the high volume of negative news that seems to follow us everywhere. As healthcare professionals, we still thought it was important to dissect this report for our audience. Many researchers and academics use this report to inform projects and policies that they hope will positively impact Black Chicagoans' health. The Thrive Alive podcast team wants to make sure that the people in and around Chicago's Black communities have access to information collected from and concerning Chicago's Black communities. If anyone at home is interested in following along with us, you can find a copy of this report on www.chicago.gov, or you can use your smartphone to scan the QR code on the screen. Some of this information may have been updated in the last 4 years, so we'll be filling in some gaps with the Healthy Chicago 2025 strategic plan, which could also be found on the city's website. With that being said, let's jump in. The mission of the Chicago Department of Public Health is to promote the overall health of the city's population through health promotion and disease prevention. Basically, it functions like the CDC, or the Centers of Disease Control, and the NIH, or the National Institutes of Health, but based on trends in city-related data. In 2020, the city's health department reaffirmed its commitment to decreasing the life expectancy gap between Black Chicagoans and other groups, which had grown worse in part because of the COVID-19 pandemic. The Healthy Chicago 2025 plan is a set of health-related goals that the city wants to achieve and lays the foundation for the state of health for Black people in Chicago report. So, what exactly do researchers mean by life expectancy? Generally, life expectancy is the average number of years a person born today may live if the conditions stayed the same throughout the course of their life. The life expectancy of an average American was about 75 and a half years in 2022, which was only slightly higher than the life expectancy of the average Chicagoan. When you break those numbers down by race, you'll find that the life expectancy of Black Chicagoans is 69.8 years, which is the lowest of all racial groups. Black Chicagoans are also more likely than other groups to experience premature death. Premature death is dying before the age of 75. The percentage of premature deaths among Black Chicagoans was more than quadruple, or 4 times that, of their non-Black counterparts in 2021. The CDPH report attributes the majority of years of life lost for Black Chicagoans to chronic diseases like cardiovascular disease and diabetes. Other causes include opioid overdose, homicide, and infectious diseases like COVID. Today, we'll focus on cardiovascular disease, HIV, and mental health-related deaths like opioid abuse. Throughout the season, we'll be highlighting healthcare workers and community members who are working to shrink the impact of these factors on Black Chicagoans' health. Topic 1, cardiovascular health. The Healthy Chicago 2025 strategic plan identifies that 41% of the years of life lost for Black Chicagoans can be attributed to chronic diseases like heart disease and diabetes. Heart disease can include a few conditions that affect the heart and blood vessels. Heart disease continues to be the leading cause of death for all Chicagoans, and Black folks are no exception, as nearly 25% of the deaths for Black people were due to heart disease in 2017. CDPH estimates that heart disease specifically contributed to 1.7 years of life loss in 2017. Some of you at home may not be surprised by this, as you may know someone with high blood pressure, high cholesterol, or someone who has had a stroke. These conditions can increase someone's risk of developing heart disease, especially if left untreated. Black Chicagoans are more likely to live with high blood pressure than other groups. As individuals, there are things we can do to decrease our risk of contracting heart disease. Moderate exercise, maintaining a healthy diet, and restricting tobacco and alcohol are good ways to maintain heart health generally. However, there are also community-level factors that may affect how often Black people develop cardiovascular disease and high blood pressure. Black Chicagoans are more likely to live in areas that the city designates as having high economic hardship, which measures factors like unemployment, poverty, and poor housing conditions. Generally, high economic hardship can increase stress, which increases the risk of getting heart disease. Black Chicagoans were also 10% more likely to report having less access to fresh fruits and vegetables than other groups. The lack of access to proper nutrition, safe places to exercise, and increased rates of stress in these communities may also increase the rate of heart disease among Black Chicagoans compared to other groups. Topic 2, HIV. HIV, or human immunodeficiency virus, is an infectious disease that is spread through bodily fluids like blood, breast milk, and discharge from reproductive organs. If left untreated, HIV can progress into a more aggressive disease called acquired immunodeficiency syndrome, or AIDS. The U.S. government began reporting how often its citizens contracted HIV in 1981, when the disease began spreading to various communities that were previously thought not to be able to catch it. The rate of deaths concerning HIV and AIDS peaked in the mid-1990s, right before the development of life-saving antiretroviral drugs. Since being discovered over 45 years ago, HIV has transitioned from being a diagnosis of certain death to a chronic illness that can be managed with more accessible medical treatments. According to HIV.gov, over 1.2 million Americans are living with HIV today, and about 13% of them may not know it. In Chicago, Black people make up around 30% of the total population, but accounted for 50% of those living with HIV. Black men were 2.5 times more likely to be diagnosed with HIV than Black women. In 2022, 2 of the 3 areas with the highest averages of people diagnosed with HIV were predominantly Black communities, and the community with the highest rate of new HIV diagnosis was also predominantly Black. On an individual level, being aware of one's HIV status is paramount to preventing the spread of the virus. Preventing the spread of HIV has also become easier over time as researchers have developed medications that can be used before and after one is exposed to the virus. However, community and institutional factors like the availability of preventive medical care can make access to testing and pre-exposure medications difficult for some Chicagoans. Additionally, negative attitudes and false beliefs, sometimes called stigmas, about who can contract HIV persists to this day, which may affect people's willingness to receive preventative or post-exposure care. Topic 3, opioid abuse. Opioid abuse is an increasingly urgent issue in the city of Chicago. According to CDPH, opioid-related emergency response services were employed twice as often in 2023 than they were in 2015. The number of deaths from opioid-related overdoses has also been increasing in recent years. In 2019, Black Chicagoans died from opioid-related overdoses at 3 times the rate of Chicagoans in general. CDPH has found that citizens returning from prison or who may be experiencing homelessness may be especially vulnerable to opioid overdose. Certain communities in Chicago are hardest hit by opioid abuse, even though people use opioids all over the city. West Side neighborhoods like North Lawndale and East Garfield Park have some of the highest rates of overdoses in the city. Certain communities in Chicago are hardest hit by opioid abuse. West Side neighborhoods like North Lawndale and East Garfield Park have some of the highest rates of opioid overdose in the city. Inglewood, a community on the South Side, is also one of the areas where people are most likely to experience an opioid-related death. In the past, drug abuse was seen as more of a moral failing than a mental health issue. Commonly, those experiencing issues related to substance abuse may have been arrested and convicted rather than giving treatment for addiction. This season, we'll be exploring the ways in which the medical community has shifted their strategies for combating opioid addiction through community-focused harm reduction. Topic 4. Gender disparities in the life expectancy gap. For those of you following along at home, you may have noticed the CDPH report on Black Chicagoans' health includes separate information based on sex. Many of the statistics included in the report compare rates of diseases for Black people in general to Chicagoans in general, and compare rates between Black men and Black women. Although the number one cause of death for Black people in Chicago was heart disease in 2017, once you break down the numbers by sex, it becomes apparent that Black men and Black women may not have been impacted by the same illnesses in the same ways. For example, nearly 10% of all deaths for Black men were related to homicide in 2017, while Black women were more likely to die from strokes than Black men. Additionally, Black women were more likely to die from diseases like Alzheimer's and diabetes, while Black men are more likely to die from accidents. To better understand these differences, we'll be talking to experts this season who work with different populations within the Black community. We want to highlight the diverse experiences Black Chicagoans may be having, even amongst each other. The Chicago Department of Public Health's report on Black Chicagoans attempts to explain the growing life expectancy gap between Black Chicagoans and other groups. The report specifically lists chronic diseases, homicide, infant mortality, infectious diseases, and opioid-related overdoses as the 5 main factors that contribute to premature death for Black Chicagoans. We want to highlight that this report only scratches the surface of the extremely urgent situation that Black communities in Chicago are facing. Since releasing this report in 2021, CDPH has continued to identify specific strategies for health promotion in predominantly Black communities. Although our podcast isn't affiliated with CDPH, we wanted to start season 3 by laying out some of this information. Since our sponsor, the AliveFaithNetwork, is committed to building partnerships with faith-based organizations in Black communities across Chicago, we thought it would be important to add some context for the work we're doing. Even though some of these numbers may be shocking, I want to impress upon you all at home, we are not starting from scratch. Chicago's South and West Sides have strong histories of resiliency, advocacy, and capacity building. This season, we'll be highlighting community change makers who are working to make sure Black communities in this city have equal and ample opportunities to lead stronger, healthier lives. As always, we want to hear from you. As an individual, what will you do or change in the coming weeks to ensure you live a healthier, longer life? How will you share this information with your family, neighbors, and political representatives? What do you think the city of Chicago can do to increase Black residents' life expectancy? Leave us a comment on Facebook and YouTube. We will be looking forward to reading your responses. If you were with us during the very first episode of Thrive Alive, you may remember the AFN Health Check. This resource was created to help us explore areas in our lives that could use a little more of our attention. The short questionnaire is self-paced and asks you to reflect on how satisfied you are with some habits that will help you live healthier, like exercising more often, eating vegetables, and seeking social support. We want to reintroduce this resource to encourage our audience to check in with yourself and your loved ones. As we approach the official start of spring, we want to encourage everyone watching and listening to commit yourself to living healthier this year. Some of us may have made New Year's resolutions and gotten off track, and some of us may be looking for new ways to challenge ourselves on our health journey. We want to hear about it all. To download this resource, go to AliveFaithNetwork.com/ThriveAlive and click on the Resources tab, or use your smartphone to scan the QR code on the screen. Don't forget to leave a comment letting us know about how you're striving to achieve your goals. Before we head out, I want to thank you for joining us today on behalf of the podcast team. I had a great time hosting my first show, and we're all very excited to continue showing you great stuff for season 3. It's important to us that we continue to serve our audience in the ways that matter most. So please take a moment to fill out our brief community survey. You can find it pinned at the top of the comments section on Facebook and YouTube, in the description of the episode on Apple Podcasts and Spotify, or by scanning the QR code on your screen. Your feedback is necessary for us to keep highlighting stories and health topics that matter to you. Thank you, and we'll see you on the next episode of Thrive Alive, where we host health talks for the whole community.